Welcome, everyone. We're here today to talk about empathy as it relates to the physician-patient relationship, Dr. Burnout, and ultimately even the bottom line. My name is Arifa Casaboy. I'm an advisor on the Medscape Internal Medicine Board, and I'm Senior Medical Director at WebMD. I'm joined today by Dr. Helen Reese. She's a psychiatrist and medical educator at Mass General Hospital and Harvard Medical School. She's also the co-founder of a company called Empathetics and the author of The Empathy Effect. Thank you so much for joining us today.
Thank you for having me.
Well, I'm going to jump right on in and talk about your book. Alan Alda, in the foreword, he mentions how empathy is really a way of reading another person's mind. I'm paraphrasing. And that impacts commerce and even politics. Tell me more about empathy, the stages of empathy, and even contrasting it with sympathy and compassion.
Sure. So I think the first thing to clear up about empathy is that it's more than one thing. So
Sure.
Our brain uses a number of different parts to actually perceive the emotions and to imagine the thoughts of others, then to process that information. And that produces an empathic concern, which motivates us to show caring. And when that caring comes out, that is evidence of compassion.
Okay.
So it's a perceptive, a processing, and a responsive arc. And the difference between empathy and sympathy is that sympathy sort of stops at caring for people, where empathy is more caring with. So
Okay.
it involves a shared emotions and our ability to sort of overlap with the hearts and minds of others.
So for the Medscape audience, why is this important? What should physicians and nurses know about this? I know you have done some scientific work on this topic.
So physicians and nurses, I think, are drawn to medical professions because for the most part, they have empathy. They have this motivation to help others, or why would they choose
Exactly.
these professions,
Yes,
right?
right.
So I think what we're observing is that there are a number of forces that are actually blunting people's natural-born empathy because healthcare is going through enormous changes right now. It's
Sure, yes.
increasingly technical.
Yes.
We have the introduction of the computer in the room,
Yes,
which
yes.
has proven to be quite a distraction from the patient-doctor and patient-nurse relationship. And so it's very relevant because I think that these inborn traits need to be reawakened and re-enlivened once we recognize that other distractions have taken our focus away from the patient.
So focusing in on that idea, the most common scenario, the clinic visit. It's the doctor, patient, and then the third person is that computer with the electronic medical records. Maybe there's an assistant or a scribe. What exactly about the improving our skills in empathy would impact that relationship and that experience?
Well, first of all, remembering that the whole reason that you're in the room is to interact with the patient.
Sure.
And because the electronic health record it's been a lot to learn. So there's been a lot of focus on just, bringing it up, making sure you're clicking the right boxes. And with any learning curve, it's the steepest at the beginning. So
Right.
I think what we've seen is too much focus on getting it right for the computer and forgetting that the person you really need to get it right for is the patient and maybe the patient's family member or caregiver who's in the room with you.
I want to shift a little bit towards Dr. Burnout. How have you seen improving empathy skills impacting Dr. Burnout and helping with resiliency?
Well, that's a big question.
Okay.
And burnout, we know is kind of a national epidemic in healthcare right now, and it's gotten the attention of most healthcare leaders. And so I think the whole issue of burnout starts with leaders' empathy for the people working in their organization, because the standards and the norms that are set for caring really have to start at the top, and then they can trickle down and kind of permeate the whole organization. So if an organization says that their institutional mission is to provide compassionate care, but the work conditions aren't conducive to that. There's a disconnect, and that can lead to, cynicism and burnout. So having work conditions that make it possible for healthcare professionals to spend enough time with patients to actually make a connection.
Okay.
It starts with prioritizing the relationships.
What can a doctor do himself or herself to really build these skills so that they can help with their own resiliency rather than relying on the work environment, and also improve their interactions with their patients?
Well, I think one thing that's really come to the fore is the importance of self-care.
Okay.
Right?
Yeah,
So
yeah.
I think traditionally doctors and nurses have been expected to give, and to actually get rewarded for not spending a lot of time taking care of themselves. And I think that shift is really starting to happen. Many institutions are implementing mindfulness curricula, empathy training, and emphasizing the importance of physical exercise and eating well. Because if we don't take care of ourselves, we can't provide that kind of care. So it starts there.
So we've talked about the physician-patient relationship, Dr. Burnout. I want to take it a step further and hear from you. I loved your section in the book about digital communications. And that idea that emojis are a way of showing empathy online. And even your topics related to the internet trolls. What kind of advice do you give doctors related to their presence on social media and how they communicate?
The presence on social media, do you mean kind of what they're putting out about
Exactly,
like how they're
yes.
communicating with patients on
And
social
even
media?
in their personal life?
Well, I think that, first of all, maintaining a professional demeanor
Yes.
on social media is extremely important. I think that how you show up at work needs to comport with how you're portraying yourself out in the world, and to actually be aware that you represent not just yourself but your whole profession. And so having a respectful web presence and social media presence, I think, is really important to maintain patient confidence in who you are.
And what kind of tips do you give for understanding where other people are coming from when they are angry on the internet or inappropriate?
I always say the first place to start is unless someone's being really disrespectful and
Sure.
really rude, but to start with curiosity, like what seems to be really driving, your comments or your sentiments. Help me understand. I think that just by showing that you're willing to listen, sometimes you can get maybe to the kernel of truth that's
Right.
in the mountain of maybe rage
And
that
that
the person's
applies-
expressing.
That applies to the physician-patient relationship as well, right? Right there in
Yes.
the room.
Like the presence.
Yeah.
I think that we're really talking about how do you show up in a room where you're making space to be fully present and welcome the really main concerns of the person that's right in front of you.
Well, that leads me to ask you, can you give us a little bit about those 7 keys to empathy?
Yes, so through this neuroscience fellowship that I did at Harvard, I tried to compile like the ways that we really connect with people in a way that would be easy to understand. And the word empathy actually can be the acronym for remembering to make E for eye contact,
Okay.
M for trying to read the muscles of facial expression so that we say to ourselves, is this person like doing well, happy,
Sure.
upset, sad? And we make that assessment by looking at their faces, which means we're not always looking at the computer.
Right, right.
Yeah, and then the P stands for posture.
Okay.
We can tell a lot about a person's emotions just by how they're holding themselves in space.
Right.
And it also refers to position. And, very often you see doctors standing up and talking to patients who are
Yes.
sitting down or standing at the bedside. We recommend getting at eye level so that people feel like they're talking to someone who's like fully there for them.
I know that's been implemented where I work.
Yeah, it's sitting down
important.
does not take more time.
Yes.
So when people say, I don't have enough time for empathy, I really challenge that. So much can happen through sitting and just making eye contact. The A stands for affect, which is the scientific word, as you know, for emotion,
Yes.
labeling that. T is for tone of voice. H is for hearing the whole person, which means if you're an orthopedic surgeon, you're not just hearing about an injured elbow, but you're remembering that that is attached to a whole person
Got
who
it.
might have
Yes.
concerns about what this is going to mean for their livelihood. And then Y is your response. And by that I mean your feeling that you're getting when you're with another person, because most feelings are mutual.
Yes.
And if we feel calm and understood,
Yeah,
chances
yeah.
are the person we're with does. But if we're getting signals that things are a little askew or awry, it's best to ask about it.
And
Like,
just
how
take it
are we
up front.
doing? Right. So that you don't leave an encounter with people feeling, upset or bad without knowing why.
One thing I wanted to take a deeper dive into was understanding with empathy as it relates to Dr. Burnout. How does improving that impact the patient and the doctor relationship?
That's a really important question. First of all, it affects the patient experience, just how they're going to leave that office and how
Yes.
likely they are to listen to or follow any of the recommendations. It affects how they think about the organization that the physician works for. It affects very important things like patient safety.
Okay.
And also patient adherence to medication and other types
Because
of
of that
referrals.
trust that builds?
Yes, because if they trust the physician, they're likely to follow through with
Right.
taking their meds.
Yes.
So empathy and compassion are directly linked to health outcomes. And my research group at Mass General did a systematic review and
Okay.
a meta-analysis that actually showed that it has a direct impact on really important health outcomes like obesity, diabetes, hypertension, asthma. So these are not just nice to have. It also affects whether patients are likely to file a claim if something goes wrong.
Sure, so it's impacting the bottom line.
In that way, it also impacts the bottom line for healthcare systems and organizations, because the Centers for Medicare and Medicaid have now decided to withhold certain monies based on patient satisfaction scores. So
Right.
they're no longer paying the full amount that's billed if patients are reporting that they haven't had a good experience. So it definitely affects actually the amount of money that the hospitals will be reimbursed, not just from CMS, but also now from private health insurers. So it's become something that has really drawn attention to the importance of this, not just because it's the right thing to do, but because there are also financial consequences.
Right, so it's not just about improving that patient-doctor relationship and building trust and that old school good feeling. This really is impacting the entire business.
And hopefully it all comes in circles back around to everyone having a better experience in
Sure.
healthcare.
Thank you very much. This interview went by really fast.
It
I
did.
appreciate having you here.
It's been a pleasure speaking with you.
Thanks.